As we mentioned before, we did not have a chapter in the book about Asian American and the extraordinary racism experienced by them during COVID-19. And it was not because we didn't think that was a worthy chapter, but there were several scholars that we had identified, and the timing to get that done was not possible. But that is, again, not something that we did intentionally. We certainly recognize the extraordinary experiences that happen as a result of COVID-19. And so today we have two scholars who are with us, Sumi Okazaki and Helen Zia, who will introduce themselves and tell you more about their background and their experiences. I'm really looking forward for this panel, and I hope that you will enjoy it and find it informative. So I'm going to introduce the two of them, and as I said, they will have an opportunity to share more about their background and their experiences. Their full bios can also be found on our website and a brief bio in the program. So Dr. Okazaki and Ms. Zia.
Hi, good afternoon, and thanks for coming back after lunch. So my name is Sumi Okazaki. I'm at NYU Applied Psychology Department, and I'm a clinical psychologist by training, although I'm not a practicing psychologist, but I've been doing research and I've been teaching about Asian American mental health and well-being for a couple of decades. And I am just so honored to be sharing the stage with Helen Zia. She is one of my heroes, somebody who's been, kind of living the activism, and living and walking and talking the activism for decades. Even, ever since I was still a student, I looked up to her. So it's quite an honor and a pleasure to be sharing the stage with her. It's kind of ironic that I have become more in demand as a speaker on Asian American mental health and impact of COVID, in the last 2 years. I'm one of those academics who have been just kind of doing my work in a small corner, somewhat marginalized corner of psychology, and I think it's I'm glad that I have something to contribute to this conversation, but it's also, I think, indicative of just how invisible often the Asian American stories have been all throughout. And so, I appreciate Dr. Wright's invitation and the opportunity to share my work with you. So because I'm a researcher, I'm just going to bring you the data and some of the recent work that my team and I have been doing at NYU. And so of course, we've heard, throughout the morning, just a really disproportionate impact of COVID in health impacts and health and economic impacts on Black Americans. At the same time, we all recognize that Asian Americans have been going through our own kind of twin pandemic of not just health and economic impact, but also that of virulent anti-Asian racism. Not that there wasn't, anti-Asian racism before the pandemic. Of course, there was, and if you actually look, go back and read the newspapers of major urban centers, Asian elders have been, victimized and assaulted and pushed off the subway platforms for a long time before the pandemic. But certainly, I think, given some of the political rhetoric, very xenophobic and anti-Asian rhetoric that surfaced fairly early on in the pandemic, Asian Americans have experienced, much more explicit racism in the last couple of years, and it's still continuing. And that summer of 2020, as my good friend and a colleague, Doris Chang, also at NYU in social work, and I started talking about what can we as Asian American psychology researchers do to kind of try to understand and hopefully contribute to prevention and intervention to interrupt the cycle of racism. We started writing grants. Most of our grant proposals got rejected, but we were luckily funded by her Silver School, NYU Silver School of Social Work, to start our work together. And so we were, I think initially interested in the mental health and psychological impact of anti-Asian racism. And of course, these photos are familiar reminders of just how Asian American communities in different segments have been affected, in some ways similarly, but also differently. That I think there is no singular Asian American experience, and that's important for us to kind of understand, how Asian Americans as an aggregate, but also in smaller segments, disaggregated, have experienced COVID and anti-Asian racism. So our team started what we're calling Kara and Aber projects. The overall goal of our research efforts is to understand the psychosocial experiences of Asian Americans and Black American adults during the twin pandemics of COVID-19 and anti-Asian discrimination against the backdrop of the nation's reckoning with our legacy of anti-Black racism. So the CARE project came first. That was the first project that was funded, and it was just with the Asian American adults. So we surveyed Asian American adults through Qualtrics panel in December 2020. So this is pre-vaccine, still, sort of a lot of anti-Asian racism going on, but pre-Atlanta shootings, lots of viral videos of elders being assaulted and killed. And then we follow up the study with another survey, this time targeting very specific Asian communities because we wanted to kind of get the diversity of that Asian American experience, but also to collect parallel data from Black Americans in May 2022. And with that project, we're also interested in understanding not just impact of racism on mental health, but also what are some of the ways in which the experience of racism are potentially, facilitating people to become more collectively, to engage in collective action, own group collective action, as well as cross-racial alliances and actions. So I'm just going to talk about three main research questions in this brief time with you. So in the first two questions that we're going to talk about is from the first data just with the Asian American adults, namely how much did Asian American adults experience anti-Asian discrimination since the start of the pandemic, and who among Asian Americans bore the heaviest burden of COVID and anti-Asian racism, and just looking separately at different segments of Asian Americans, what factors were associated with poorer mental health outcomes for East, Southeast Asian, and South Asian Americans. And I'll get to the third question a little later on in the talk. So just to kind of start off with the profile of the Asian American adults that we collected the December 2020 data. We were happy to, get a sample of, nearly 700 Asian American adults with a fairly wide age range, starting from the 18-year-olds all the way up to the 80-year-olds. And so, of course, many people in our sample were working age adults, but we were also able to get some older folks as well as young adults. Women tend to do these surveys more than men, so we have a little bit of a gender imbalance. And in terms of ethnicity, we just kind of asked for anybody who identified as Asian American, and largest chunk of our participants are East Asian, with Chinese Americans representing the largest. But we were also happy to be able to collect data from Filipino Americans and Indian Americans. Those are the largest Asian American groups in the United States. And then we were also able to get data from 43 states, primarily from metropolitan areas because that's where Asian Americans live, with the largest states represented in our sample. And importantly, I think because we asked for the zip code information about our respondents, we were able to think about like what are the macro context, potential geopolitical and sociological context in which these Asian Americans were living and surviving. And then nearly 2/3 of our sample were born in the U.S., and a fairly highly educated sample, but that's, again, fairly representative of the Asian Americans. And just quickly, we actually did a pretty long survey, but these are the variables that I'm going to be talking about. So we asked about, sort of the stressful life events that happened since the start of the COVID, anything from death of the family members to losing jobs, changing routines, having to move, and so on, down to just really, kind of much smaller level stresses. We also asked about racial discrimination experiences that were specific to COVID. So we took Carissa Chia's measures on specific COVID-19 related racial discrimination against Asian Americans, and we also were able to assess whether they were directly impacted versus vicariously impacted, whether it happened in person or in line. So I'll be talking just about the direct versus vicarious discrimination. And then we also added some items from the Stop AAPI Hate report. So we asked anything from have you been verbally harassed? Have you been physically assaulted? Have you been questioned about your ethnicity? Have you seen Asian, Americans either demeaned or joked about online and so forth? And then we assessed psychological distress, anxiety, depression, generally speaking, as well as worry. And just in the aggregate, Asian Americans were reporting, and these are, not selected Asian Americans. Unlike the Stop AAPI Hate, which is a self-selected sample of people who have experience and want to report, these are Asian American adults just kind of selected from a larger, national panel. And, disturbingly, but not surprisingly, a good number of them reported both kind of low-level avoidance and shunning kind of microaggression to verbal harassment and name-calling in person and online. And then 1 in 8 were reported being physically assaulted. So again, I think these are confirming that Asian American adults overall were experiencing a level of anti-Asian harassment and sometimes assault that should be of concern to all of us. So overall, Asian American discrimination was associated with poorer mental health. So just at the level of sort of, bivariate correlations, direct COVID-related discrimination was significantly associated with more distress, so more depression and anxiety, as well as more worry, and also vicarious COVID-related discrimination. So just seeing things happen to other people, not directly targeting them, was also associated with more depression, more anxiety, and more worry. And in the aggregate, what we noticed was that there were certain predictors. So this is just kind of looking at the, multiple regression, hierarchical multiple regression type of analyses, that those who identified as being a woman were more likely to report more life stress, more racial discrimination, and poorer mental health. Being younger also was a predictor, and we know that young people were suffering, in terms of mental health, but they also were reporting more racial discrimination, and perhaps because they're more online, as well as having interactions and being more attuned to their environment. Those who are born in the U.S. reported more stress, discrimination, and poorer mental health. Being uninsured, not surprisingly, were also a predictor. And then, kind of somewhat contrary to our prediction that South Asian Americans and Southeast Asian Americans, so Asian Indians, Pakistani Americans, Filipino Americans, Vietnamese Americans, were reporting more of everything, including more racial discrimination compared to East Asian Americans, especially Chinese Americans. I think in our hypothesis, which we were following up by doing some interviews with Chinese, Indian, and Filipino Americans, tend to suggest that Southeast Asian Americans and South Asian Americans, because they have very different racialized experience in the United States, and because they, many of them identify as brown Asian Americans and have alliances with Black communities and communities of color, unlike some of the more recently immigrated Chinese Americans who might experience, racism in the United States very differently. So we think that South Asians and Southeast Asians might have been more primed because of their own racism experiences, especially post 9/11 for some folks, that they were much more attuned to detecting racial discrimination. So we thought it's important for us to just, look at each group separately to understand what were the, factors contributing to their greater psychological distress. And for East Asian Americans, not surprisingly, even though they tended overall to report fewer direct racial discrimination experiences, when they did experience those, racial discrimination, they were much more affected and their mental health was more impacted. In addition to being younger, so younger Asian Americans were more, had poor mental health and more pandemic life stress. In contrast, the Southeast Asian Americans had a lot more predictors, things that were associated with larger distress. So being a woman, being younger, having public versus private insurance, more pandemic life stress, and more direct racial discrimination. So we were able to look at the differences. And then South Asian Americans, even though they were reporting more racial discrimination, in the end, when we entered all the factors to see what was most predictive of mental health, that it really wasn't the racial discrimination. It was much more about just sort of the stresses and being having more life circumstances that were predictive of their poor mental health. So just the quick key takeaways from this study was that a sizable number of Asian Americans reported experiencing anti-Asian microaggressions and even physical assault, and overall experiencing more racial discrimination, both direct and vicarious, but especially direct racial discrimination was associated with poor mental health. Again, I'm not telling you anything that's surprising, but we certainly have evidence to support our hunches. And then South and Southeast Asians reported experiencing more racial discrimination than East Asian Americans, but that when we kind of separate out the groups, the factors that predicted, predicted is a statistical term, but certainly associated with poor mental health differ by ethnic groups. Again, underlying our insistence that Asian American experience is not a singular experience, and it's really important to disaggregate by group and to be able to understand, each of the separate communities and their experiences during COVID. So I'm going to just turn to the third question, which, after we were kind of puzzling over and were really surprised initially, but I think the more our research team talked about it, it made sense to us that South Asian Americans and Southeast Asian Americans are having a very different kind of experience. We were kind of interested in doing our next study where we were not just, staying at the level of victimization of racial discrimination, but also looking at what predicts sort of positive coping through collective action and doing some, kind of pro-social work. And so in this study, we, we're a little bit more purposive in our sampling and asked for equal number of Chinese, Filipino, and Indian and Black Americans in the sample. And we also asked the Qualtrics panel to give us 4 representative sample from 4 regions of the United States so that we could do much more regional level analyses. We're not quite there yet, but we certainly have the data. Again, women tend to answer these questions more, and then certainly there are some educational differences that's reflective of the Black and Asian American communities in the United States. And in this study, in the previous study we only did it in English. In this study we translated the survey into Chinese so that monolingual Chinese individuals could also take the survey. Filipino and Asian Indians tend to have, fairly high English fluency, so we were more, concerned about not being able to get recently immigrated Chinese. In this study, in addition to, some of the mental health the data that we collected, again, we were interested in kind of looking at the racial discrimination that were, both COVID-related, but also, specific to each group. So we, asked our African-American colleagues to come up with, potential COVID discrimination that were prevalent in the experience among Black communities, such as being questioned about, the authenticity of your COVID vaccination or other kinds of discrimination. And then we asked about sense of linked fate. To what extent do you feel like your, life's lot is connected to those, from the other group? We also were interested in sort of critical awareness, or how much do people understand that this sort of systemic racism that's affecting Asian Americans are also affecting Black Americans in a way that upholds white supremacy, and are people are there differences among people who are able to have that kind of a critical awareness versus those who are not? And then we also finally asked about intergroup activism or allyship, so participating in actions that support, the other group, Black Americans or Asian Americans, since the start of the COVID. So, it started with, there were 16 questions that we could ask, or 16 activities. And it could be anything from, putting, a Black Lives Matter sticker on your, computer or backpack, to donating money, to supporting ethnic businesses, to marching in protest, educating oneself, educating others, and so forth. So on average, Asian Americans, the largest sample, engaged in average of 3.5 out of 16 activism or collective action on behalf of Blacks. Asian and Indian Americans were far more likely to engage in Black allyship than Chinese Americans, and then more women than men. And then Black Americans were also asked about, how much they did these things on behalf of Asian Americans, and on average about 2.25 activities out of 16, and there were no gender differences. So we were interested, I think, in this preliminary analysis to say, well, given that people differ within each community on how much they're in, developing critical awareness, how much linked fate they feel with the other group, and how much cross-racial activism, we wanted to see if our kind of hypothesized model of how, which things predict which. So with the Asian Americans, we were able to kind of fit this model. This is in the aggregate, where COVID-related discrimination, the more discrimination you felt, were more likely that you were able to kind of see the systemic racism as the potential cause of their racism, the experienced racism. They also tended to also lead to more linked fate with Black Americans, so they felt like their lot was, cast, together with the Black Americans, and those were all predictive of cross-racial activism. We tried to fit the same model with Black Americans, and unsurprisingly, because the racial histories and the racialization experiences of Black Americans and Asian Americans are quite different in this country. As much as we want to have a narrative about racism, I think we have to recognize that Black Americans, just the COVID-19 racism experienced during COVID-19 for Black Americans were not predictive of greater critical awareness or greater linked fate, but those Black Americans who already had critical awareness of systemic racism and those who felt more allied with Asian Americans in their linked fate were also more likely to engage in cross-race activism. The model that we thought described the Black American experience more accurately in terms of cross-racial activism, especially related to Asian Americans, was just a sheer awareness of COVID-19 related anti-Asian activism, that the more Black Americans were aware that this was happening to Asian Americans, the more they had also endorsed critical consciousness, which in turn led to cross-racial activism. So these are some of the early preliminary analyses, and we're continuing to analyze the data. We have a lot more kind of contextual macro variables as well as the relevant variables, but just to kind of leave you with where we are in this key takeaways that the majority of Asian American and Black Americans experience at least one instance of COVID-19 racial discrimination, if not more, for both groups. Racial discrimination was predictive of cross-race activism, and there are, of course, common factors that lead to cross-race activism, but that the role of COVID-19 discrimination in activating group consciousness seems more robust for Asian Americans, but not for Black Americans. So I'm going to just end with a quote from Yuri Kochiyama, one of the Asian American activists who, worked closely with Malcolm X and had, a wonderful history of showing us the way for Asian Black, allyship. And she said, "The movement is contagious, and the people in it are ones who pass on the spirit." So just a quick acknowledgement to my team. Doris Chang is my co-PI. We also have Harvey Nicholson, Maureen Craig, and Tu Nguyen, who are faculty collaborators, and then our wonderful graduate students who, do a lot of the analyses and, push us always to kind of think, about the implications of the work that we're doing. So with that, I'm going to turn it over to Helen, who's going to give us much more of a larger view, contextual and historical view of the work that I'm doing.
Okay, good afternoon, everybody. Okay, let's shake that lunch up a little bit. Come on. So anyway, thank you, Sumi Okazaki, for really a pioneering study. There are really very few surveys and studies as comprehensive as this one, because there really just has not been a lot of interest in funding or looking at a population that's as diverse linguistically, culturally, and all of those things as Asian Americans. What I thought I would do is share a little bit along the same lines of what Dr. Okazaki did, but go a little bit more anecdotally, give a little bit more examples from the kind of things that she talked about. I'm a writer, I'm a journalist, but first and foremost, I've been an activist in my life. And one of the areas that I've been an activist for many decades is anti-violence work, anti-hate work, anti-domestic violence, and anti-violence in general, and especially trying to do multiracial solidarity work. But so I'll be talking about some of that, and during this COVID pandemic, I worked on two studies. One is, and I will actually be sharing the URLs for these two. I have a small number of hard copies here that I managed to put in the overhead on the plane. And so some of you, if you would like a hard copy, I'm happy to share that with you, or you can look up the PDFs online. So I'm going to be talking about, and also I just want to thank the Cook Center and Dr. Gwendolyn Wright and all of you who put on this really, really important conference. So thank you. So just to say, these are sort of some of the summary points I'll be looking at. And in talking about anti-Asian hate, we know that hate and violence has been on the rise overall, not just in the USA, but globally. And we know that anti-Black hate violence has been way up, as well as pretty much violence against every marginalized group, non-binary, gender, domestic violence has been up through the ceiling around the world. And so within that context, anti-Asian hate has really been a wave that we have not seen in a very, very long time. And so starting in 2019, before any cases were even mentioned, even afraid of that it might come to the USA, Chinatowns and Little Indias and areas of Asian American concentration were already feeling hate, violence, vandalism, and especially the most vulnerable in our communities, women, children, elderly. And one of the points I'm going to be talking about is how many people express surprise that this kind of thing could happen. That, wow, we didn't know Asian Americans ever experienced racism or discrimination. And even among Asian Americans ourselves, in our own community, on social media, people would say, somebody just, shoved my family, or, while I was taking the garbage out, threw acid on me. And I never knew this could happen. So I'm going to explore that a little bit more. And then toward the end, talk about leadership in this time, where we all know that the conversation is how divided we are as a society, and what can we do when so many of our communities are facing violence and division. So yes, these are text heavy. Not all the slides are text heavy. Of this slide, I just want to point out, this is a summary of something that comes out of a website called stopaapihate.org. They are a single website based in California. They have been collecting data from people who self-report incidents of hate that they believe is hate toward themselves. And so of this, I just want to note that within the last 2 years, they have recorded 11,500 incidents. And this is one website. We know this is a huge undercount because, first of all, people have to be aware that the website exists. And however, that does provide a lot of data. And on that website, they analyze some of that data. They recognize that gender non-binary folks, women and girls, and the elderly and have a sort of double or triple jeopardy that makes them more of a target. They've also found that parents, in addition to the things that cause mental health stress and worry, parents, if they're at work or away, are worrying about their children as well as their parents. So this adds to the kind of things that were talked about this morning that add to stress in terms of the bad effects of racism and health. And so the other note that they have is that the hate happens everywhere in America, in their tracking of 11,500, that it's not, many of the reports are concentrated in cities. California, 1 out of every 3 Asian Americans in America is in California. There are a lot more incidents reported there, but it's within, all through America and everywhere in between the coasts. So I want to go through some of the data and drill down a little bit. So where are these incidents happening? What are the sites of these discrimination and harassment? Well, the vast majority of them are in public places. Businesses, meaning the grocery store, the supermarket, the gas station. Those are at the big box stores. At Sam's Mart was a terrible attack on a whole family where a 2-year-old and a 6-year-old, as well as their father, was slashed. And so 40% of the incidents happen in public businesses, places of work where people have to go and shop. Another 20% are on public streets, bus stops, subways, sidewalks, going for a walk. 11% public parks, 10% public transit, and then 11% are online. So these are things people cannot avoid. And so that's where the majority of these attacks have taken place. If we look at some of the trends, and Dr. Okazaki, Sumi's data showed the thing about disaggregating, we can actually see the ethnicity of some of the major Asian American groups. And so Chinese, yes, there is a lot of data tracking the rhetoric that came out, especially out of the last presidential administration, that at dates where there was a lot of China virus and Kung flu that echoed throughout America, the spike of attacks was, closely had a close correlation to that. But also that it's not just Chinese who have been attacked. Really, there are many different ethnicities, and not only Asian. There have been examples of Latinx people who happened to be near Chinatown, who there was maybe a perception by the attacker that they could have been Asian. But in any case, just the association also led to those kind of attacks. So the ethnicity is across the board. And then what about youth? So the data around youth and high schoolers is also very, very interesting. So 60% of the attacks on youth or harassment of youth are by adults. It's not other kids. 60% is adults. And in 50% of those cases, there was more than one adult who was actually harassing children. And in almost 50% of the cases, there were other adults around, and those might have been teachers, administrators, people at the playground, other parents, who also did nothing. So these are the kind of things that are being reported, and in 56% of the time, it involved making fun of some kind of Asian language. And every Asian American grows up hearing stuff like ching chong aso, or things that are imagined that my Chinese immigrant parents spoke to me at home, but they didn't. It's just some sort of made up kind of language thing that is part of the harassment. Also, that overall in these statistics, 2 out of 3 of the incidents are toward women, and of the youth, 2 out of 3 are toward girls. So clearly there's also a view of who is more vulnerable. And then I wanted to look at the essential workers, Asian American essential workers. And the earlier panel with Dr. Robertson and Dr. Edwards had some breakouts on that. And you'll see here that Asian Americans and Pacific Islanders are heavily represented in the health professions. That was also reflected in their occupational breakdown of stress factors and mortality. And so of these essential workers, Asian Americans are reflected in essential work that includes service work. Asian Americans and Pacific Islanders are very heavily involved in restaurant, hotel industry, things like that, cleaners, delivery people. So it's not just what you would think of as, and I'll get to this a little bit later, the overwhelming view of Asian Americans as professionals, but also people who are involved in the kind of service and essential work that is not normally associated with Asian Americans. And I guess I should put my reading glasses on, sorry. And also you'll see in the very first line here, it's doctors and nurses. This is the biggest bar. And many of you are in, maybe doing work involving the health industries or health professions. And so why is this number so high? Well, number one, there is a skew in terms of American immigration where a brain drain has been created over several generations to take the doctors and nurses of countries like the Philippines and throughout Asia and bring them to America. And there's a phrase that Asian Americans talk about, which is, we're here because you were there, you meaning the American government. And so that's one reason that that particular figure is so high. But with these essential workers, during the height of the lockdowns and so forth, the social media was filled with essential workers, whether they were people going to work in their scrubs as nurses or healthcare workers being attacked. And so they were on their way to save, maybe that person's life or their family member's life, or taking care of them in a senior facility or assisted living facility as a healthcare worker and aide. And so a lot of those attacks were also recorded. And so in Sumi's data, she was saying that a lot of parents worry about what's happening, to their children. Well, so here are healthcare workers who are doing all of the kind of worry that was talked about in the earlier, with the nurses who were on the stage, experience all of that stress, but also worrying about what's happening at home for their kids or for their parents who might want to go for a walk. So what was the impact of this on, and there's one other thing about, with such a high percentage in the health professions, the mortality rate of nurses. So last year, the 1 out of 3 nurses who died during COVID was Filipino. And so that is something that, when we hear about this in the Asian community, it's like, where's the headline about that? And those of you who watch television news and the weekly things of like, who are our heroes, our healthcare heroes and so forth, I would watch and say, well, if we have so many Asian Americans in the health professions, where are those heroes? Just to give a face to it. Well, so this is part of, I think, what both of us have been talking about, not just that these things are happening, but that they are invisible. And the idea like, wow, I didn't think these things could be happening. Like, or why is this happening to me? The invisibility is also part of the racism. So I want to give 2 examples of 2 groups that were part of one of the studies, this study about Asian Americans fighting dual pandemics, COVID and racism. So there were 2 healthcare centers that were looked at here. Both of them serve a majority of low-income public health insurance recipients. And what was the behavior they witnessed? So in Asian Health Services in Oakland, California, they found that more than 90% of their clinic visits stopped. So people were simply not going in any way to just outside their homes. So their patient load, which is quite large, suddenly dried up. And what was happening, they found, were people were going underground. And so some of the data on what people experience is they didn't leave their homes. So they didn't go get their meds. They didn't follow up on chronic care visits. They didn't go to any doctor visits. They just let everything slide. And so the Waianae Coast Comprehensive Health Center in Hawaii, in Oahu, Hawaii, which services mostly Native Hawaiian and Pacific Islanders, also found, in addition to people not going out, Pacific Islanders and Native Hawaiians live primarily in multi-generational, family units, so that there are the grandparents, maybe the great-grandparents, parents, and then children, and young people going out, and so these communities, and coming back to a multi-generational family. So these families were being devastated, but also not going to the clinics. So these Asian and Native Hawaiian clinics had to quickly shift, figure out how to reach their clients, their patients, and switch quickly to telemedicine and trying to teach people how to use an iPad, get them to them. And if these families were not going out at all, to how do we get their meds to them? How do we even have a doctor visit? So some of them, Asian Health Services, for example, started mobile units as well. And all of this took incredible shifting and funding, like how do you equip a mobile unit to provide these services? Now they have a mobile mental health unit as well to actually go to the neighborhoods because the people were not coming into the clinics at all. But so this is one of the experiences. And so in looking at the impact of COVID on health and COVID on the health of the Asian American Pacific Islander community, number one, when people go underground, it's much harder to get data about what's happening. What is their morbidity? What is their mortality? And so some of the information is just not really sufficient, which is one reason that Dr. Okazaki's research is so important, because there is so little data out there. And so those are some of the findings that we see. But so the overall impact has just been very devastating, not just the hate crimes and the stress that puts on people psychologically. And we know that whether we call them microaggressions or micro-racism or harassment or physical assault, and the fear of that assault on you and your loved ones especially, all of that gets transmitted in a cellular level. And it will be interesting to see long-term, any long-term studies on how this period and the disparities of how they've affected communities of color, how that's affected our communities in the long term. So what I just went through is reflected in this study, this report, and the URL is up there, onenationaapi.com/commission report 2. And I have some hard copies up here as well. And so I want to now segue to the point that I mentioned in the first slide of gee, I didn't know this kind of thing could happen to Asian Americans, or I didn't know this could happen to my own community, and that feeling of surprise. And so the shock of surprise and the realization that you had been living in a cave where this kind of thing is going on is also part of the racial experience of being Asian in America. So this is the story of a young man named Vincent Chin. And I'm just going to talk briefly about this. I lived and worked in Detroit, Michigan 40 years ago. I had gone there to work in the auto industry. I was a factory worker at Chrysler Corporation. And in the late 1970s, during another economic crisis, a recession in the whole country, a depression in the Midwest when the auto industry collapsed, I became unemployed, an unemployed auto worker like hundreds of thousands of other people. And so I was there during a time when, like today, somebody else had to be blamed. And so back in the late 1970s and early 1980s, and I probably have a lot more gray hair than most of you, but some of you may remember that was a time of extreme anti-Asian hate, except back then the enemy was considered to be Japan. Why? Because the auto industry had tanked and they had to blame somebody for the reason that American cars weren't selling anymore. Of course, they only got 7 miles a gallon, and price had gone through the roof if you could even get any. Fuel-efficient cars were more popular, and so even though Germany pioneered fuel-efficient cars, it wasn't that German Americans were targeted, it was Japan and people who looked Japanese. And so Vincent Chin was a 27-year-old Chinese American back then. He was about to get married. He was at his bachelor party, went to a sleazy bar, and in this climate of hate, 2 white auto workers sat across from him and said, "It's because of you mother Fs that we're out of work." Now, one point is, they weren't out of work. They were giving the collective, "we are out of work." And so by the end of the night, they had a baseball bat and beat Vincent Chin to death. Opened his skull. He was on Woodward Avenue, the main drag in Detroit. More than 70 people witnessed the whole thing, so there was no question about what they had done. And the reason I particularly mentioned that they were white is because by the time they went to the courts to be sentenced for what they did, the judge took one look at these 2 men who are now wearing suits and very clean-cut looking and said, "These are not the kind of men you send to jail," and gave them probation for beating a man to death with a baseball bat. And this is in the city of Detroit, of course, where if you were black and you just looked the wrong way while you were jaywalking, you'd end up in jail. And so there was quite an outcry on this, but the small Asian American community was not organized. This is 1982, 1983. There was not a movement of Asian Americans to stand up and talk about civil rights. It just hadn't been done before in a mass way. And so out of this, and I was part of this time, the Asian American community got organized and stood up and had hard discussions in rooms like this where every seat was full of people who had never spoken up in their lives. They had taken all those micro-races and microaggression, but said, "I have to speak up now because this could happen to me. This could happen to my kid." And so, for the first time, began to have, cooks and waiters and laundry workers marching alongside engineers and doctors. And so this was a milestone and a landmark not just in the Asian American community, but so in this time of anti-Asian hate today, one thing that gets mentioned within our communities is this Vincent Chin case. But the thing that I want to point out is it wasn't just about the Asian American community. The other thing that happened was, we're in Detroit. It's a very multiracial community. And it was very clear, as I started out, saying that the hate, violence, and so forth that's going around in the US and the world today is affecting all groups. And so every group gets affected by hate violence. It's not like it just stays with one group. It spills over. And so we went through the process of the hard work of organizing, reaching out to the Black community. There's a large Arab American community, Latinx community, as well as interfaith communities of all backgrounds. And so this is just some of the news photos of that time. And to me, this is the enduring lesson of that 40-year-old experience, which is that in order to counter any of these disparities, whether they involve hate violence, whether they involve health, as Dr. Turner said this morning, it really is going to take a collaboration. This is where we are today, and all hands on deck, all society issues, disparities in health and violence in our communities. This involves all of our communities. So I wanted to share a little bit about how people respond to learning about this story. And I'm not going to read all of that, but what happens is there's a documentary that's been made of the Vincent Chin case, came out about 30 years ago. And so different professors, teachers, high school teachers have shown this documentary called Who Killed Vincent Chin? It's available. It was just remastered, by, the Oscar Academy, and it's being shown again. And sadly, this thing that happened 40 years ago is very relevant today. But so one teacher, and that's recorded in this guide that I will share the URL to as well, showed it in her classes which were, had Black, white, Asian students in them, had them keep a journal and write about what their thoughts were. And I thought I would just read a little bit of what some of these students said. One Asian American female junior said, "When the lights came on after the Vincent Chin movie, I couldn't move. I dared not move till most people left. Then my friend came over and said, 'Are you okay?' Then I started sobbing. I could not stop." I have a whole new way of understanding what it means to be Asian in America. I thought it was my bad luck to be stuck living in a neighborhood and going to a school that I went to where people hate Asians. I never thought my experience fit into a pattern that a whole group of people had had for more than 100 years. I never knew there was a thing called anti-Asian violence. If you had asked me before now if there was a lot of violence against Asians, I would have had to say, no way. I would have said that African Americans really got violence against them, especially from the police. I'm wondering how different it might have been if I had learned about Vincent Chin and other Asian American issues back in school. Here's the journal from an African American senior, a male. "I've never heard of Vincent Chin. I've never heard of racism against Asian people. No offense to you and other Asians in the class, but to me, Asians have it the best. They have their culture, they have their money, they just take care of themselves. They don't even have to learn English if they don't want to. They don't like Black people, so I don't like them. I don't have any Asian friends. I don't beat up or kill Asians like in this film, but I don't like them either. I took this course because it fit one of my requirements. I never expected what we're studying. It's more like one of the Black history courses I took. I look at this Vincent Chin movie, and then at the reading this week on Asian Americans as the perpetual foreigner and the kind of racism that's called anti-Asian violence, and I feel kind of speechless at the moment. My first question is, how come nobody taught this to us in school? And I went to an excellent school. My second question is, why don't Asian people talk about it more? How come Asian students here don't talk about it? Do they know? Do they care? And my third question is more personal. Do I think differently about Asians now that I know more about anti-Asian racism? Wow, this is really a big one. It's one of those things I have to really turn my head around. I can't promise I'll be able to do it in one day, but this is something I'm really going to think about. Maybe I have to look at my own biases. And so there's more, but those are some examples about when people learn about some of these things. And I'm going to try to quickly move here. So this is a page. I don't expect you to see any of these actually. What it is a whole list of anecdotal incidents of Asian Americans who have been killed in the last 30, 40 years. It's anecdotal because there is no record keeping on this. These are things that just made it to the news level headlines. And I just want to share a couple of examples here. One is in 1984, a young woman, 19-year-old pregnant garment worker, was standing in front of a subway train and pushed in front of it by a man who said he had a fear of Asians. And so the police determined that this was not racially motivated because fear is not hate, even though he pushed her in front of the subway and she was decapitated. In 1985, a young girl, 8 years old, was found hanging in a tree. She had been kidnapped, sexually assaulted, and then hung from a tree. Only a few months after Penthouse magazine ran a so-called feature story in their soft porn magazine featuring Asian women in different positions of being dead, for example, hanging from a tree. This was also not viewed as a hate crime, and by the way, that was right here in North Carolina. In 1987, an Indian American man was killed by a group of youth who called themselves the Dot Busters. And as they attacked him and then beat him to death, they said, "Hey, Hindu, hey, Hindu." The prosecutors didn't consider this to be a hate crime because Hindu and Dot Busters, these are not considered to be race-oriented words. And in 1989, 5 Asian children in Stockton, California were shot to death in one of the first mass school shootings by a fellow who suited himself up in his camo fatigues, took his semi-automatic weapon, and shot into the schoolyard of a school that was 80% Southeast Asian kids, and killed 5 of the 8-year-olds and one of the teachers. And the immediate response by the police was, oh, this has nothing to do with race, and an outcry by the Asian community actually brought on an investigation by the state attorney general that revealed that the guy actually had white supremacist ties. And there's a lot more of these kind of things that are listed here, but that kind of brings us to March of 2021 last year, where something very similar to what happened in Stockton happened in Atlanta, right? The Asian businesses run by Asian women, those spas, and 6 Asian women and 2 bystanders were shot to death. And the very first comment by the police on the ground the next day was, oh, taking the point of view of the white young man who shot them, oh, he's just having a bad day. This has nothing to do with race. It's about sex addiction, which brings me to why do people have these impressions? Well, so I just added this to give you an idea of, these are the 2.5, I would say 2 overriding stereotype images of Asians in America, that for people who know nothing about Asian Americans, this is what goes through their head because this is what they learned on cartoons and from Hollywood. And it's Asians as the perpetual alien invader. And by the way, that includes being a pathogen because Chinatowns have been completely burned down in American history for fear of the bubonic plague, because Asians and then Asian women in particular are viewed as disease carriers. And so what happened in Atlanta actually had everything to do with race and racism and the history of Asians in America. So, and then there's the geek. And by the way, I put gooks in parentheses because it is a racial slur to Asians. And so there's the gooks, the geishas, the genderized form, and then the geeks. And this, of course, is Mickey Rooney, a white actor in Yellowface, which is what has happened a lot in Hollywood, but pretending to be a really offensive, geeky Asian American. And at this point, that has become the dominant view of the dominant stereotype for Asian Americans. So I'm going to just check the time. I'm going to just speed through the next few, but I want to talk about solidarity, okay? Where do we go from here? And in Sumi Okazaki's research, I found it very encouraging to see that actually both Black and Asian communities have, some basis to communicate and see solidarity in making change together. So these are 2 individuals. I think some of you might recognize Frederick Douglass on the right. Frederick Douglass, why is he up there? Well, in the late 1880s, when the Chinese Exclusion Act was happening, he stood up, as well as a lot of other African American leaders, and said the Chinese Exclusion Act is wrong. It is bad. To identify and single out Chinese to be barred from America is harmful to the Black community. It's harmful to the democracy. So here was a Black leader in our history who stood up, to say that the Chinese Exclusion Act was wrong. And next to him is Wong Kim Ark, who was one of the people who was barred from the U.S. He was born here. He fought his case all the way to the Supreme Court to say, I was born in America. I'm an American. And all the way along the way, he was denied and told that, no, the Chinese Exclusion Act means you have to leave. He actually took it to the Supreme Court, and in 1898, he won. And so, one of the earlier speakers talked about, well, they all talked about resistance. about countering these things. Well, there were in the Asian community people who were fighting these things too. And so he and the Asian community went all the way to the Supreme Court. And because of his case in the Supreme Court, every subsequent generation of immigrants and refugees from everywhere could thank Wong Kim Ark for the fact that if you were born here, you're an American citizen. So those are two people who were in the late 1800s. Here's another point of solidarity, and I call these things MIH, missing in history. This is, of course, the Reverend Dr. Martin Luther King, the first line of march going over the Pettus Bridge in Selma, Alabama. What are they wearing around their necks? They're wearing leis. Where did the leis come from? They came from a whole contingent that came from Hawaii to be part of the Freedom Riders and the Freedom March here. You can see they brought a banner with them saying, Hawaii knows, integration works. And so besides this group from Hawaii, there were other Asian Americans who were part of the Freedom Riders, but their stories go missing in history. And even though they were part of these essential points of American history and fighting for civil rights in multiracial allyship, this kind of thing is missing. And so we have many other examples, but this is one of Cesar Chavez and Larry Itliong, who is Filipino. And actually there were the Chicano farm workers and there were the Filipino farm workers, and they were kept separate, and the idea was that they would never unite and therefore would never be able to fight for better living conditions and working conditions. And Larry Itliong approached Cesar Chavez and said, why don't we unite? And so that led to the great grape boycott and the United Farm Workers. And so in genderized, Congresswoman Patsy Mink was the first woman of color to be elected to Congress. And what is she known for in her time in Congress? It was fighting for Title IX and Title VII for gender equality for women and girls. And we can also look at marriage equality. The marriage equality movement that led to the ability of same-sex partners, like my ability to marry my wife, who we've been together for 30 years, but it was only until 14 years ago that we were able to get legally married. That first lawsuit was generated in the state of Hawaii, and these are Asian and Pacific Islander plaintiffs who got that in motion in the US and around the world. So I just want to conclude by saying that, it takes work to build the beloved community. We are at a time, and I really mean all of these disparities and divisions, we have to look at how this affects all of us as a community. And the word community has unity in it. And so Reverend Jesse Jackson is sitting there with Lily Chin, the mother of Vincent Chin. Reverend Jackson was the first civil rights leader of any race to stand with the Asian American community. And we know during this time of anti-Asian COVID hate, Stacey Abrams, Mayor Lance Bottoms, Kareem Abdul-Jabbar, they have all stood up and spoken, but this kind of thing goes missing in history. It doesn't make the headlines. Instead, things like viral videos showing black assailants against seniors gets shown over and over again in social media and on television broadcasts, when actually two studies, one in the University of Michigan and one in the University of Maryland, have shown that actually the vast majority of perpetrators against Asian Americans are white. And so these are the kind of things, and there are many Asian Americans and Pacific Islanders who have been part of the movements for Black lives. So, all right, there's a lot of education that needs to be done. I just want to show you that this is one of the things in this Vincent Chin Legacy Guide that is talking about the history of the civil rights movement. And we are translating this into Chinese, Vietnamese, Korean, Bengali, and every Asian language we can afford to translate it into, so that our immigrant Asian Americans can also learn about the civil rights movement in America and about Black history as well. So this is it. It's going to take all of us together. And I'd like to end with a quote. Oops, here are the URLs. I already gave the one for the One Nation AAPI Commission Report, and the Legacy Guide is available on vincentchin.org/legacy-guide, and you'll find it all there. And it's part of the Vincent Chin Institute, and there's my website. So this quote is from Nelson Mandela, Nobel laureate. Vision without action is just a dream. Action without vision is just passing time. But vision with action can change the world. And I just want to thank you all for your patience and for listening. Thank you so much. And we have copies of the of this, both of these, if for anybody who would like.
Thank you so much, Dr. Okazaki and Comrade Zia. In the spirit of Brother Malcolm and Sister Kochiyama, I have a two-part question for you. In order to move beyond the performative activism, right, should the approach be allyship, right, which is often a co-opted term within white supremacy culture, especially with the movement of technology? Or should it be coalition building, which I think you alluded to, across different communities? Because I think what I'm getting at is, given the co-optation of allyship, there's this white liberal norm to be nice to each other, when sometimes the issue is not being nice, but it's to get through to the structural. So I was wondering if you could speak to that.
Sure, I'll just say a few words. So, I think you're right, the allyship. Can you hear me? Can you hear me? Oh, okay. Maybe the mic just needs to be closer to my mouth. So certainly I think you're right, that allyship can be problematic in terms of how we conceptualize and define it. I think in my talk, I was kind of using it as a little bit of a lazy shorthand for coalitional work. Certainly, when I teach this work in psychology, we talk about not just being an ally, but being an accomplice. That implies that we're in it together and that we're working together. So I think you're right, and thank you for pointing that out.
Thank you. I think that's an important point. I don't like the word allyship so much, and precisely what you pointed out. I think, and that's why I bring up unity. I mean, allyship is great, but we have to move toward unity. And can you hear me in the back? Yeah, okay. So I'll just, and unity, what does that mean? If people look at the time when I grew up in the civil rights movement period, that it was all kumbaya and people just happened to come together. No, it takes a lot of work. It takes working through principles and values and what it is we're working toward. And it actually takes a lot of discussion. And then, so it's really what, back in those days, we would say principled unity. It's not that we are just hanging together and feeling good with each other, but we know we're working toward something that is really for the greater good, and why. And so that's, I would really love us to get to that solidarity based on real unity.
Thank you so much. And so my second part of the question is, due to the high levels of oppie hate and continued violence throughout history, what are some ways that different communities can be accomplices to the oppie in order to reestablish the trust? Because that's something that I am seeing break down across the country, is that there, due to de jure and de facto segregation in the history and levels of violence, that the oppie community is turning inward and not trusting. So what can we do as different communities to be accomplices in that coalition building? Thank you.
Yeah, so I think briefly, as psychologists, we think about, how do we, build more awareness of that structural racism and just really developing racial consciousness. And, I think part of it is that, younger people, I have a lot more hope that they are more aware of the structural racism and how racism against Asian Americans are coming from the same place of white supremacy as Black, racism against anti-Black racism. And so I think some of the work is really, coming from the young people in terms of really educating not just themselves and their communities, but also their parents' generation. One of my former students, who's now a professor at DePaul University in Chicago, has been doing some anti-Black educational work with Chinese communities in Chinatown in Chicago. And I think that's the kind of, I think more, forward-looking coalitional work that's happening within Asian American community. I'm eager to hear how, we can, work more in hand in hand with the Black community to try to, bridge that gap. Because I think you're right that, there are divisive forces, and I think we have, Asian Americans communities also have to own up to the anti-Black racism that's been taught to us, not just within the U.S., but also, globally, that I think many immigrants bring that anti-Black racism from Asia. So again, it's hard work to unlearn and unteach that, and the more we can kind of work together.
And I would just add that people have to be in a space together. And what Sumi just said about there's been a lot of forces at play, I mean, really the last 50 years or so, what we're seeing happening in the Supreme Court, this court is going to, they already did Roe v. Wade, they're going to be doing affirmative action, they're going to be also doing all sorts of things deliberately to add to the attacks on different communities of color. And so this has been deliberate, it's been going on. There are think tanks that, invest hundreds of millions of dollars into how to keep people divided. So it's not easy to overcome those things, but really, organizing is about bringing people together. And sometimes in the California Bay Area where I am, there are a lot of efforts in poorer communities that include Asian and Black and Latinx communities to bring people together over bread, to have a meal together, to try to have conversations. And some of those conversations have been very hard, where, and I've heard some of these conversations where, from the Black community, people are saying, well, how come you all have so many cars and so many people, in one place, in one house, and you're taking up all the parking areas, and you all have so much money, which may or may not be true. And from the Asian community, it's, well, why do your children hate us so much? Do you not teach your children how to respect, elders or things like that, where it's hard. They're coming into a meeting together with a lot of assumptions about each other that aren't going to be dealt with, easily or simply, but it is part of just getting to know each other. During another pandemic in the 1980s, the HIV pandemic, there was a thing directed to the LGBTQ queer community that was come out. If you can come out, you must come out, because silence equals death. And so people who could pass as straight had to come out, and because the lives of their communities depended on it. And I have to say, I think within our communities, we can see today that I say this to the Asian community: silence equals death. Silence is not doing nothing. One of the other panels said this. Silence is actually an action. It's a position. It's saying, I'm not going to do anything. The status quo is okay. So as difficult as it is to bring people together and have these conversations, that's where it begins. And today with social media, it makes it easier for people to not have to talk to each other. But there's nothing that takes the place of sitting in front of somebody, getting their nonverbal communications about how they're feeling, and being able to connect in that way. So it really starts there.
So this question here, and then we'll come over there.
So Dr. Helen, first I want to thank you for opening my eyes even more to the hate that does occur in the Asian community. But I have a question for Dr. Sumi. Based on the data you collected and the results that you see, my question has to do with how are you disseminating this information back to the participants in your study? Are you doing lay summaries? How are you sharing your data? Thank you.
Thank you for that question. Thank you for the question. Because the data were collected through Qualtrics panel, and they don't allow us to track back to the participants, so we can only do public dissemination. Certainly in academic papers, but we have a website, and we try to, our graduate students are just wonderful in being able to create social media friendly summaries. So we're trying to do our best to communicate kind of widely our findings and to translate that into things that are, news you can use kind of bits. But certainly, if you have ideas about how we can better disseminate the work beyond sort of the, the interested parties, that would be wonderful.
Okay. So my question here is for Dr. Okazaki. I think you said that Asians were, in your study, empowered by organized efforts to inform them about COVID. And I think, in fact, Asians have had the lowest incidence of COVID infections and death in the US, Asian Americans, including whites. So I'm wondering if you could say more about those efforts and what other groups can learn from those strategies that were developed.
I feel like that's not my wheelhouse, and so I would defer to folks who know better about public health. Certainly I think within Asian American communities, part of it was just kind of going underground, as Helen said, to not expose themselves and being mindful of the intergenerational or multi-generational households that really, I think at the cost of many things, protected their elders and children. But certainly I think, masking was a widely practiced health behavior in Asia that, I think early on in the pandemic, I know that many Asian American psychologists were trying to get everybody to mask when the CDC was saying, no, you don't have to mask. And certainly I think there were lots of racism directed against Asian Americans who are masked. And so certainly I think there's been some cost to the, the health behaviors that have been protective, but, oh.
And also, it wasn't that long ago that the SARS epidemic was happening as well. And so Asian communities had already been through, in this millennium, I think, of being targeted for disease. And so the issues of trying to not just be safe, but also trying not to be targeted, because, in wearing a mask, it could also be perceived that you're trying to protect, to not spread germs. So that is part of the, the history for Asian Americans, that we have been identified as disease-carrying plague bearers. So, that might also be part of the sort of inherited genetic awareness of that.
Hi, Sumi and Helen. Thank you so much for just all your insight today. I was wondering, from a policy perspective on how to counter anti-Asian racism, can you explain the criticism against more stringent hate crime laws or policing or more monitoring in Asian American communities as a way to fight anti-Asian racism?
So the whole question about policing and law enforcement and either being pro-carceral systems or anti-carceral system is that your question, sort of?
Yes.
That is a very big debate that's going on in the Asian community. And I have to say that, that there is, in my opinion, not a lot of productive or constructive conversation going on about it. So there are people who feel like San Francisco, for example, they recalled a progressive district attorney because they felt like he was not prosecuting people who had killed, Asian community members. And they were strong enough and organized enough and loud enough that they were able to be a very active part of that recall. At the same point, there are a number of community organizations, a lot of Asian American community organizations that are saying, no, we have to, more money for police, policing is not the solution. That law enforcement is not the point, that whether it's education or greater mental health services or social services or providing for housing and food for those who are insecure, I mean, that is really the ultimate direction to go in. So these are two very different opinions, and in between, there are communities that feel totally under siege. And so, unfortunately, you've put your finger on a place where the Asian American community is still debating this, as well as, society overall. But looking at what are the systemic, systemic oppressions and infrastructure that must change in America, this is definitely, the Asian community is very much involved in this debate, but not talking to each other, I guess. Did you have any suggestions on that? Because this is part of the debate of America at this point.
Can you hear me?
Yeah.
I just wanted your perspective as the experts, but sure, thanks. Something I've just been encountering in my work, I'm a reporter at Facing South magazine, which is based here in Durham, but covers the South. Just a lot more kind of consideration of the rising abolitionist framework. But then, in reality, when discussing these things or writing about these things, you also have to take into mind just very serious issues such as, up until, I believe, 2020, Georgia didn't even have a hate crime law, right? So that kind of preceded, obviously, the Ahmaud Arbery murder and the massacre earlier this year in Atlanta at the spa. So I think, like you said, it's a very complicated issue that I think needs to be delved into more and covered. So, but thank you for your answer.
So I think we'll have a chance. Oh,
Question up here.
one more question. One more question. One more question.
How much do you think the strive for capitalism and economic advancement has been I don't want to call it a stopgap, or something that would kind of kept Asian Americans in a path that was not considered to be so much with the racism, and I'm using the term so much. I mean, there has always been, and that being in that track more so than maybe, just considering on the whole African Americans. So until the pandemic, do you think do you think economics really is a part of this racism and how it's unfolding?
Again, this is just me talking off the top of my head a little bit, but certainly I think there has been sort of this narrative of scarcity, especially in places where Asian Americans and Black Americans are working or living or sharing the space. That's somehow what gets allotted to, or what is perceived as Asian Americans taking up that economic mobility journey is at the cost of Black Americans. And so I think that's not an unfamiliar narrative, but I think it's also a divisive narrative that we have to be able to resist and to point to the data about how and partly I think just kind of understanding for both communities that Asian American immigrants would benefit from greater education about just how they're why they're here, is because of American interventionism overseas that brought Asian Americans to the U.S. and how they're entering into a large, long racial history that they're not always mindful of. And on the other hand, Black American communities also not being as aware of sort of the immigration history and sort of the immigrant dreams and so the single-minded focus on getting an economic foothold in communities, and how sort of the economic structure is such that it makes it easier for Asian American communities to establish small businesses in Black communities and so forth. So again, I think some of it is just more awareness of the structural forces that put the two groups into same space, and rather than to make it into a collision course, to really educate the communities together about how that kind of scarcity mentality is not not productive.
Yeah, and I would just like to add to that. There is I had the three stereotypes of Asians, and one is the geek, but in that picture, but it's also the rich geek. Is that a lot of people assume that, well, Asian Americans are all wealthy, and that's something you hear a lot as a trope out there. And the reality is that Asian Americans of any racial group have the widest disparity of income. So there are incredibly wealthy Asian Americans that we tend to hear more about or see more in the news, as well as very, very poor Asian Americans. And that's where disaggregation of data is most helpful, because it's not like all these Asians should just be lumped together as one. And so, so anyway, I guess I would just make that point too. But what Sumi is saying is that it's part of the structural racism and where Asians fit in this puzzle and this hierarchy, if you will, of racism or evolution of systemic racism is Asian Americans have, since the large waves of migration as indentured labor in the early 1800s, were brought in between the white plantation owners and the Black enslaved labor. And as slavery began to, on paper, become, the trade was illegal, even though it continued for another 100 years, Asians were brought as labor in larger numbers. And so right there was the structural placing of the triangulation of being in between. And so there's really a lot about this. But so, and the other thing is the largest current immigration period for Asian Americans was after the Civil Rights Movement, partly because the Civil Rights Movement changed the immigration laws to be less favorable to white Europeans. And so larger numbers of Asian Americans have come to the U.S. after the Civil Rights Movement without knowing anything about the Civil Rights Movement, why there is one, was one, the inequalities. And so this impression that people could come here and just focus on making money and staying out of issues like race and racism, unfortunately, has been something that now, with this pandemic, some people are waking up to it. There's even a Asian American investment banker group on Wall Street that has come out saying that they have to take a stand on anti-Asian racism, which is sort of like, thank you. It didn't just happen, so it's as Sumi said, it's a complicated issue. It's rooted in capitalism overall, very much, and how capitalism, in American wealth formation was based on keeping people separate from each other, pitting groups against each other, bringing Asian labor to one area so that they would never be able to unite with other workers, like the grape fields in California. That was a very calculated, deliberate policy. And so we're living with the effects of it now. And so how to bring part of it is education, so people understand why we're here today, you know, in the place we are, and what we can do about it, not take it as an assumption that, well, we can never come together, or you know, one group is the good minority and another group is the bad minority. I mean, all of those are part of the mythology that, you know, some people have drunk that poison, and we have to, you know, unpoison people. Thank you all. And there are copies of these that I'm going to leave up here, so please help yourself.